Minds. In this video, I speak to Laura Mills, who is a psychiatric nurse, and she is going to share with you her experiences taking antidepressant medication. And she's also going to talk about her experiences with withdrawal. I hope you find this video informative.
Hi, Laura. Thank you so much for joining me here on Two Healing Minds.
You're welcome. Thanks for having me.
Yeah, I really appreciate it. And just to get started off, what led you to the decision of starting on an antidepressant? And was there any turning point in your life or a recommendation to start taking antidepressants?
Yeah, so I started, it was for work-related stress at the time. So this was back in about 2010-ish. So I had quite a stressful job at the time. So that was the main reason. So it was my choice. I went to the GP. I actively asked for something to help with the stress. At the time, I didn't really have too much understanding of how hard it would be in the future to come off. So that was the decision I made. And yeah, I went to my GP. I knew about antidepressants because I'm a mental health nurse. So I was quite sort of familiar with them. And yeah, they prescribed me an antidepressant.
Well, it's interesting that you chose to go to a general practitioner. I know that's an option for most people, whether they go to the general practitioner or a psychiatrist. Was there a reason for you to choose your general physician?
Yeah, I guess because it was kind of, in my mind, it was a sort of a low level kind of stress,
Mhm.
anxiety, if you like, at the time. So I didn't think I needed to go to a psychiatrist. And I know with the antidepressants that I wanted to start, it's like usually a first line of treatment. So I guess from my own kind of knowledge, I knew that a GP could prescribe an SSRI. It was citalopram. So that's why. And I guess I didn't really have, other than the stress at work, I didn't really have any other difficulties at that time. I think my mood was okay. Naturally, I think everybody has ups and downs in life.
Mhm.
But yeah,
Absolutely.
so yeah, that was why, and the GP prescribed it, but it was my choice to start that.
Okay, and you already answered what you were prescribed, which the generic name is Celexa. And so it was Celexa, right?
Yeah, absolutely. Select.
And what was the dosage of it? And the doctor, did that he or she offer it as a long-term or temporary solution, or was there a discussion about that as far as the usage?
Yeah, so I started on a really kind of, it was lower than the therapeutic dose. So I started on 10 milligrams of citalopram. I took that for I think about a month, and then I asked to increase it to 20 because I knew that that was a kind of a starting dose that may be helpful. So I started on that. Um, to be honest, at the time there wasn't any discussion about how long I'd be on it. I think what I had in my mind is, you know, it'll be quite easy to start, and it was. I didn't have too many problems, but I thought at the time that it would be quite easy to get off. So I suppose in my mind, I wasn't. I guess I wasn't consciously thinking about the future, if that makes sense. I was just kind of thinking,
Yes.
job is, it's really quite stressful. I think I've got a kind of natural tendency to worry anyway. That's just part of my personality. I don't
Mhm.
pathologize that. But yeah, I didn't really give it any consideration, which sounds strange being a nurse, but I didn't really think about it. I thought, I can take it for a few months, and then when the stress goes down or I get a new job, then I can come off this medication. So it's
Yes,
never
that
long
makes
term.
sense.
Yeah.
I can understand your perspective because you're looking at it as a tool, like, hey, I need something to help me right now. Like, I am going through this immense stressful period in my life. I'm not looking long term. I'm looking for the now. Can this help me now? Perhaps
Yeah,
that was your perspective. I'm not looking from a year from now, six, like, hey, I need to start this now.
absolutely. Yeah, no, exactly right. And at that time as well, certainly in the UK, I don't know about anywhere else, but in the UK, there wasn't a lot of understanding around the potential of withdrawal. So that wasn't something that I even kind of thought about. And I think as well the education with the doctors, it's probably not something that they were told.
Mhm.
So from where I am, I very much, although I'm quite critically minded now, I still take full ownership of my decision because we didn't know
Mhm.
um, about the potential for how hard it might be coming off. But yeah,
Yeah, that does make sense because your first visit with a primary physician or psychiatrist, you're there for help. You're not thinking long term. You're not thinking, well, what if down the line I want to get off of it? You're first trying to take the first step. Well, I haven't even started it. Why am I thinking of getting off of it when I don't even know if it's going to work? So I can understand your view. Of course, you're not going to be thinking of that. Logically, that's not why you're there to begin with. And perhaps the same with the doctor. They're thinking, well, this patient is in crisis. I'm here. I have to do something. I have to help them. I'm a doctor, so I have to prescribe them something. And perhaps they're not thinking, well, why would I be talking about withdrawal when they haven't even started the medication?
yeah,
We don't even know how the medication works or if it's going to work or what side effects. So in that respect, I can understand, like, why am I going to tell them about withdrawal? Or
yeah,
this might perhaps be a hard medication to get off.
yeah,
So it's kind of hard when you're thinking about that when you're first visiting.
yeah. No, that's it.
And but when you first started the medication, because uh, your first concern should be like, okay, well, is this medication going to be working for me? And what are the side effects? So did you have any side effects? And how long did they last if you did? Or did they eventually subside?
I think for it's a long time ago, but from what I remember, I think there was an initial increase of anxiety. I think I felt quite on edge. There was probably a little bit of insomnia. Um, that resolved within a few weeks. They did take several weeks to take effect. So I think it was at least 4 weeks that I started to feel less stressed, I guess. Um, so those kind of initial side effects, they did wear off. What I was left with, I feel, over the years, and still am left with, if I'm being completely honest and transparent, is I'm left with other side effects that I kind of live with at the moment. Um, so fatigue is one that can be quite problematic. Um, Unfortunately, I have a PSSD to a certain degree. I don't talk a lot about that, but I do have that. Um, so they're the main ones that I live with at the minute, and it's been a case of kind of, I think with everybody, it's weighing up the risk, the benefits of your of
Mhm.
your chosen treatment. Um, so yeah, so I do live with some side effects.
And I think you did make an important point there is when, I don't know if you called yours, if it was just anxiety or if it was a combination of anxiety and depression, you do have to weigh the risks and benefits. Like how much benefits am I getting from the medication compared to the side effects? Can I tolerate the side effects? Is it okay if I'm just like, have insomnia for a while, or if I'm just getting a little upset tummy? Would it eventually subside, but I'm still getting the benefit of the med? Yeah, that is an important point that you made. But as you said, you've had, is it chronic fatigue from long-term use?
Yeah, I didn't realize, but for many, because I've been on antidepressants for over a decade now. I've tried to come off, and I'm sure we'll talk a little bit about that. Uh,
Yes.
um, but yeah, I've been on them over a decade, and I thought I had a chronic fatigue or a kind of something like that, and I didn't realize at the time that it was the medication. But having tried to get off the medication, that side effect went. I now realise that actually that is a direct correlation with the SSRI. So it absolutely presents as a chronic fatigue that I've had for many years. I manage it. Sleep hygiene,
Mhm.
simple things like exercise, water. So it's not the end of the world, but it wasn't something that I initially thought was the medication. But now I do realise it is.
So do you find you're talking about you've been on the same medication for a decade, or it's different ones?
So I've been on SSRIs for over a decade. So citalopram was something that I started on, and I'm now on a different SSRI.
Okay.
Yeah, yeah.
Okay, so do you think overall, well, I mean, perhaps it's yes, because you've been using it for a decade, that the medication has helped you as far as managing moods, emotions, daily life? Because I find that some of the medications, if you're off of it, your moods, emotion regulation is harder. It could be
Yeah.
like up there, but then you're like on the medication. I'm like, gosh, I feel a little bit calmer. I don't know if that was an example for you, or what are some for you that has benefited you?
So So what I originally went on the medication for was, I guess, a stress, a kind of life response. And if I'm honest, in hindsight, for me, I probably should have looked at other methods, but this is just for me.
Mhm.
Um, because I've had a lot of difficulty over the years trying to get off the medication, because of what I now know through my own kind of clinical knowledge and my own research is with withdrawal to a medication that my brain has become used to. So whenever I've tried to stop the medication too quickly, my mood it will just crash into a very depressive state. Now this is a state that I have never experienced before taking antidepressants. So this is something I do speak quite passionately about, and it's not to scare anybody, and it's not to tell anybody they shouldn't go on medication, because it is so different for everybody.
Mhm.
But I do think we need to recognise that these medications, do require, a really careful, evidence-based taper, um, because every time I've tried to get off these drugs, my mood has become almost like dysregulated, my
Mhm.
whole um, so so I'm on them because I've had difficulty getting off them.
Yeah,
And
that makes sense.
yeah,
It's
yeah,
it's like it's a dependency on it, where you're so used to taking the medication, and if you abruptly stop, your brain is going, well, what happened? What, this is this is like a shocker. I know withdrawal is hard as far as, especially if you do it abruptly or on your own. So you have to go at the guidance of your doctor too. And also, were there certain points? Oh, I'm sorry, I have to go back to the fact because you said originally you took it for high stress, anxiety, and sometimes high stress and anxiety doesn't necessarily mean you have depression. So does that mean you didn't have depression? It was just mostly for anxiety and stress for like at the on the job?
Yeah, absolutely. So I never suffered depression. I think probably like most people, I had natural times when I felt better than others, depending on what was happening in my life. But I've never suffered clinical depression. Um, However, now when I try and come off antidepressants, I fall into a depressive state, which I believe is because of the medication and the dysregulation from the long term use of these medications. But yeah, um, I never had depression before. It was mainly sort of mild anxiety.
It's
Um,
interesting.
yeah,
The reason why I say interesting is I know I just go by the name Celexa, is a first line of treatment also for people that have depressed mood, for depression. So I'm not knowledgeable as far as if they can just prescribe it only with a diagnosis of anxiety, but I know it's a first line of treatment for depression. And it was interesting that you said, well, gosh, when I came off of it, I got depression. And yet they use that for people. That's when they go in to see, especially a psychiatrist, that's what they would prescribe as a form of treatment. So do you think that, I mean, in your opinion, do you think that was a good choice of medication from your general practitioner for
I think
anxiety or stress? I mean, I know it's good for anxiety too. I mean, I'm not a doctor, but just in your personal opinion.
yeah, I think so. The depression that I suffered when I tried to come off it, I feel it was more kind of a withdrawal, which I believe would resolve over time, hopefully,
Mhm.
or be minimised by a more slower um, evidence-based taper. So I did a taper that was too quickly, not realising this. Um, so now I understand more about hyperbolic tapering, and the guidance that I need to refer to. So I have this level of understanding now. Um, but I think so for some people, SSRIs, they are prescribed for anxiety. And that is something that should be discussed with the GP and the person going, whether it's for obviously the first line of treatment for medication treatment for depression, but it also people can have it for anxiety as well. But in my case, I think I wish I had, in hindsight, looked at other methods, I guess, to kind of manage that stress at the time,
Mhm.
uh, because the difficulties I face now, they're more than when I started. If this is in my situation, now I always say it's like a scales. It's about risk and benefit. So if somebody, is extremely depressed, um, they can't manage with whatever's happening to them for whatever reason, then it's choice, and that's absolutely might be an option to discuss with their doctor. But how I see it is for general kind of life, normal stresses, it should be thought about with a bit more caution. And I think
Yes.
other options should be on the table as well.
Yeah, that makes sense. So it's just the doctor. Uh, I mean, in my opinion, I feel like psychiatrists are more suitable because they have more experience and more knowledge about the medications. But as you said, they have to use the judgment. Is this patient suitable for this medication? Or am I just haphazardly just giving them something? As you said, just with daily stressors, like you can manage it on your own, or with therapy, you don't really need a medication. So I can see what you're referring to, better judgment, right, by the physician in order, like, should I give this medication or should I suggest something else to them?
Absolutely. And I think as well that on that point is it kind of all centers around that kind of informed consent. So if
Oh,
somebody's
yeah.
feeling um, depressed or anxious, so you know you see a GP, you talk to the person about all the options that they have, the potential risks,
Oh, yeah.
side effects that may happen, then they've got all that information. So I always say it's something between the prescriber and the person
Mhm.
when they have all that information, so that they're making a full informed decision. I guess that's kind of where I sort of sit with um, with medication, psychiatric medication.
Yeah, that's very important. Informed consent. It definitely. And yeah, because it's interesting because you're work in the field also. And so you work with patients that are on medication. And if you think about this, the decade of being under or taking SSRIs, can you think of an amount of time that you tried to withdraw? And what did you find challenging about it? I mean, how often do you try? Or when it was, I'm sorry, let me start. When was the first time that you decided to withdraw after you started it, that you thought, you know what, I think I'm ready to get off of this medication?
Yeah, no, absolutely. So I started in about 2010 with a
Mhm.
stressful job. My first attempt was about 2015, so about 5 years later.
Oh,
For a
okay.
job, life was, I guess, a bit easier. I was in a better place. I was less stressed, so I tried to come off. I followed the guidance at the time, which was over a few weeks. I now believe we can confidently say that that's too quick.
Hmm.
So,
I agree. But yeah.
and yeah, I had brain zaps, I had dizziness, I had nausea, I had panic attacks, and I was very mindful that every kind of stimulus felt a lot more alive.
Mhm.
The lights felt brighter, sound felt more uncomfortable. And I kind of put that down to my nervous system had been kind of dampened down for so long that it kind of all was like, whoa. It almost felt like coming out of a kind of it just everything felt very overwhelming. So I panicked and I thought, well, gosh, this isn't. I don't like this. So I went back on citalopram. Um, I reinstated the 20 milligrams very soon after I upped it to 30 under medical advice. Because at that time I didn't have that level of insight that actually what was happening to me was withdrawal.
Mhm.
So I went back on. The second time, so I tried to come off about 2 or 3 times, but the last time was 2003, which was the most recent time, and this is where I've become a little bit more critical and a little bit more vocal now because I had um, the worst time of my life coming off this medication. I did it again I took longer, so I took 4, 5 months.
Oh.
Uh, so I took
Mhm.
longer. And I was off the medication for about 2 months. And then I was suddenly hit with a very severe depression, um, almost 24/7 sort of panic, insomnia, um, horrible kind of intrusive thoughts as well. Nothing that I'd ever experienced. Um, this time I realised what I was going through, and I realised it was withdrawal. I'd done a
Mhm.
bit more reading. I sort of heard a bit more about protracted withdrawal. but because I'd done it so quick, and I personally feel my nervous system was so kind of dysregulated and
Mhm.
kind of upset with me, is
Oh,
the
yeah.
simple way of sort of saying it. I made a decision to reinstate again. Um, so I'm now on fluoxetine, which is, you'll know what what was known as Prozac, and I'm now on a lower dose of fluoxetine, because I couldn't tolerate the withdrawals. Um, so
Hmm.
it was really hard, but it's really opened my eyes to a lot of um, a lot of things, a lot of information, and I'm kind of glad I went through it because, um, looking back over my kind of career, I can kind of resonate with a lot of things that I might have seen, uh, and I do think we need to be really cautious and mindful when, if anybody chooses, and it is individual. It's not, I always say I am not anti-medication. Um, that's not where I sit at all. But these drugs don't come without risk.
No, absolutely. It seemed like you had a lot of severe symptoms of withdrawal. And sometimes they tell patients, oh, or patients feel like, oh, now that I came off the medication, I'm going back into my depression. Or maybe a medical professional lets the patient know, you see, you're reverting back to your depression before you were on the medication. But the big but is like, maybe I'm not. Maybe these are just temporary withdrawal symptoms that I have to experience and get through, and hopefully they subside. So it's really hard to distinguish that
God,
because
it's so
it's like when you stop a medication, am I going back to being like moderately or severely depressed before I started the medication? Or is this a temporary withdrawal and I just have to be strong and go through it and hopefully it kind of takes care of itself over the months? So that's kind of hard to distinguish because automatically a doctor will say, oh no, you have to go back on your medication. You see what's been happening to you? You see, you have your mood swings, you have big emotional reactions, maybe self-sabotaging behavior, and then you think, was that withdrawal or is it that I'm just going back to what I was before? So that is hard
it's so
to
hard.
think, like, which is it?
It's so hard, and is it as well? Is it a bit of both? And
Yes.
is if somebody's been on medication for so long, you know, that person might not have been experiencing their full range of emotions. So in part, when they start to come back, that might feel quite uncomfortable, quite shocking. Um, so it's the water's really muddy, isn't it? It's
Mhm.
really difficult. And this is where I kind of don't, I'm not anti-medication. I think there's lots of factors involved here, and that's why I say ultimately it's up to that individual. Um,
Yes.
but this time I've got a much better insight and a much better plan on how I should hopefully be able to come off successfully.
Yes, and also it's because the SSRI has to do with releasing serotonin, and I think it's just recirculating the serotonin, and all of a sudden when you stop it, well, that process stops too. Of course, your brain or your mind is going to feel different. Not to get into the chemistry of it, because I don't know much information about that, but that has a lot to do with it. And just to be talking about, in your view, do you think generally antidepressants, there's SSRIs and SNRIs, are there greater challenges between one or the other to withdraw from, or are they pretty much the same?
I think again it's individual. I think, guidance would say medication, possibly the SNRIs like duloxetine and venlafaxine, can be harder to come off, possibly because they act on uh, two transmitters in the brain. But I think it's individual, and I think I think it's fair to say we still don't know perhaps a lot about how they work, or what they do. I think a lot of it is that. I think we know duloxetine, venlafaxine, paroxetine is possibly harder, the shorter half life. But then again, I think fluoxetine has a longer half life. But I don't think there's any guarantee with any kind of medication drug that to me they're all going to have some kind of effect
Yes.
in your body that needs to kind of be respected and considered.
Yeah, and obviously actually all the antidepressants does create a dependency on them, because it's just like with anything, your mind, your body, it's getting used to something, used to a medication. So I do feel like there can be dependency on it too, which could make it even trickier to withdraw from the medication. But if you were to give advice to someone who is trying to withdraw from their antidepressant, other than, yes, they have to get advice from their general practitioner and psychiatrist, but as a patient with experience, or a person with, not patient, person with experience, what would you recommend?
So for me this time, I'm kind of building up my toolbox of resources that are going to help me, give me the best chance of getting off them. So obviously we know it's going to be a lot slower. It's going to be guided by a GP. All this will be a lot more safer. But having these other measures in place as well. So surrounding yourself with positive people. Of course, we can't protect ourselves from all the negativity in the world. That's not realistic. But there's a lot I would do differently. I wouldn't expose myself to a lot of things that I expose myself to, because I think if you add that negativity on top of withdrawal and on top of trying to adapt to the world again without your medication, you have a recipe for so I think there's lots of things that you can do, and it's individual, like whether it's exercise or I think it sounds very kind of cliche, but I think that's where I went wrong as well. I think we I think people have to have hope, whatever they choose, and that's something that's really kind of stuck with me as well. That kind of an acceptance as well. That's been a big part of my kind of recovery, because when I realised what had happened, I felt quite a lot of shock and upset that, I can't get off this medication. I thought I could get off it in a few weeks. I can't. And I felt quite a lot of despair about that. But part of overcoming that, I've learned to accept the situation that I'm in, and actually, a lot of the past we can't change. We can't control, but we can accept how we manage and think about things now. So I'm a lot more focused on kind of mindfulness, I guess that is. And I find that really kind of comforting as well. And I think that's going to be really helpful in the future. Because I've always sort of worried a lot when I was younger. It's a lot better now, but when I was younger, that kind of worry about other people's kind of perception of me. But actually, you can't change that. And so much of my healing in my mental well-being has been accepting that there's so much that I can't control. There's a lot of unknowns, and that's okay. And feelings and thoughts, they're okay as well. So I'm not going to run away from them. I'm going to accept them and feel them. And I think that's probably going to be helpful.
No, that's excellent perspective. By you sharing, it's not just the medication. While you're on the medication, you have to work on yourself. We all have different sensitivities, inner workings, how we relate to the world, with relationships, with a work environment. There's so much, and we have to kind of go within and say, what is it that I need to work on myself? Obviously, there's going to be events that you have no control over. Bad things will happen. That's just a given. But as you said, you have to have ways to work through it within yourself as you're taking this medication. You're not just relying on the medication to take care of it all for you. No, you're still working on your life, right?
Yeah,
And your sensitivities in
absolutely,
life.
absolutely.
Yeah, and one final question, Laura. If somebody is considering an antidepressant, for some people, it's such a hard decision, especially if they haven't been taking a prescription drug for most of their life. And then they're on the fence about, like, oh gosh, I'm going through this really bad, anxiety and depression. And I'm going to give an antidepressant a chance. What would you want them to know before it's starting?
So knowing what I know now, the main one is knowing all the risks, having an open and transparent conversation with the prescriber about the potential adverse side effects that may or may not happen, but having that kind of insight so that if somebody does become, in the worst case scenario, suicidal, and that's something that's close to my heart, because that happened to me in withdrawal. But if you give that information, then that person will be able to understand that, oh, this could be the medication, and then that's something that they can go back to their prescriber and address. And also, with consent, talking to family members as well. So if somebody's decides to go on a medication, does the family know what signs to look out for? Because in the initial stages, I don't think people know who is going to have a reaction and who is not.
Mhm.
That, to me, I feel, I guess, if I'm being honest, a little bit uneasy about, and that's where people need that informed consent. And it's not to scare anybody, because that might be the last resort, and that might be something that saves that person. So it should be on the table, but people need to know about what might happen, because I think that would save lives just as much.
Well,
Uh,
absolutely. Those are
yeah,
such important points, and not to be ashamed, embarrassed, have these open conversations with your doctor, ask questions. Don't be silent about it. Don't think, oh, this is a terrible question to ask. Don't be embarrassed in front of family members or whoever you're residing with, friends, roommates, or anyone. See if you can find someone that you can trust and let them know what is going on and the medication. And hey, if I get some reactions, it could be from the medication, just so you know that I'm going through this and how they can help. Very good advice.
yeah,
And
yeah.
I really appreciate you, Laura, for sharing this information with viewers, because I know it's going to help a lot of people about antidepressants, SSRIs, potential side effects, and making